President Trump is pushing back over criticism that he questioned if doctors could inject patients with disinfectant to help those with COVID-19. We will hear what he had to say today from the White House in just a few minutes. But ever since last night, health professionals and doctors all over the world have been doing some damage control. Ross Guidotti is live with more. Ross.
You know, when you think about it, the concept of putting something that could potentially kill you into your body to make yourself feel better is counterintuitive. But believe it or not, there has been at least one example of something like that happening during this pandemic.
Whatever his intent, almost immediately after the president's statement Thursday, the internet and social media was ablaze with comment and consternation over using Clorox Lysol or even bleach to battle COVID-19. For instance, the makers of Lysol and other disinfectant products quickly put out a statement that under no circumstances should our disinfectant products be administered into the human body through injection, ingestion, or any other route. Even the Surgeon General tweeted to please always talk to your healthcare provider first before administering any treatment or medication to yourself or loved one. Now, why would anybody even consider doing it? Well, these are unprecedented times we live in.
People are stressed and anxious and searching for answers that at times some solutions may be presented that, you know, despite maybe some initial reticence, people will try.
Dr. Michael J. Lynch, medical director of Pittsburgh's Poison Control Center, said cleaning products would kill the virus for sure. And its host.
It can burn. If you swallow it, it can cause injury and damage to your stomach and internal bleeding. If you inhale some of these products, it can cause lung injury and coughing.
Now, as strange as it sounds, people have already died from poisoning themselves during the pandemic. Most of us have heard of hydroxychloroquine. It has been used with some success to quell COVID-19 symptoms. Unfortunately, several people purchase chloroquine phosphate, a powerful fish tank cleaning agent, thinking it was the same and would battle the deadly disease. Some of those people died as a result.
Sometimes things that seem sort of fairly obvious and logical, at face value or face validity, turn out not to be so easily transferable. So saying something kills a virus and then being able to use it on a human, that doesn't necessarily transfer.
In the end, Dr. Lynch says this is very simple. If it says it can kill you on the label, believe it.
Use your head, and if you don't know, because all of us don't know something or lots of things, ask people who do.
Finally, another example of how information that's very wrong can spread and hurt people. The nation of Iran has been devastated by COVID-19 as well. Unfortunately, rumors started to spread in Iran and actually other countries in the Middle East and Southwest Asia. That said, if you drank isopropyl alcohol or perhaps wood alcohol, it would keep COVID-19 from infecting your body. So far, at least 300 people are dead from taking that advice. Reporting live, Ross Guidotti, KDKA News.